Okay, so chapter 13, it's about the PNS, peripheral nervous system. So some learning objectives for this chapter is to be able to identify the formation structure and branches of the spinal nerves, including roots, rami. We're going to list the spinal nerves by region. We're going to see what are dermatomes, what is the importance, clinical importance, and we're going to see the formation of plexuses, nerve plexuses, and we're going to see how the neurons form communication pathways that we know as reflexes. And then we're going to see the different type of reflexes that they exist, and we're going to describe them, and we're going to see the components of the reflex. Yeah. Okay, so the peripheral nervous system has some major divisions. It has sensory and motor. Sensory is afferent because it sends action potentials into the spinal cord or the brain, depending on the nerve. So we have within the sensory, somatico-sensory information coming from our skin, muscles, and joints. And then the visceral sensory will bring information from internal organs, like, for instance, how distended is your stomach, what is the distension of your blood vessels to see if you have enough volume or not. So basically senses blood pressure. And then for the motor or efferent division, we have the somatic motor that commands these muscles, the skeletal muscles, to contract. And then we have this movement through voluntary control. And then we have the autonomic nervous system, which is part of the visceral motor system that controls the contraction of the heart and internal viscera, like the uterus, the vas deferens in the case of males, the urinary bladder, etc. So those are under involuntary control. Differences between somatic and autonomic nervous system. Somatic motor only uses one neuron pathway. It controls the skeletal muscles and is, again, under voluntary or conscious control, while the ANS, it is a two-motor pathway, and you have a neuron that is called preganglionic neuron that connects to another neuron that is called postganglionic neuron. And then this one is subdivided, ANS, majorly into sympathetic and parasympathetic, but also we have another one that's called enteric nervous system. So here are the different divisions of the PNS. So we already saw components of the brain and the spinal cord. Now let's look at the peripheral nervous system. So here we have somatic sensory division with connections of sensory neurons or afferent neurons, which are called general sensory neurons, bringing information into the spinal cord or into the brain with these general sensory neurons, and in the case of the special senses, like the eye, with the special sensory neurons. But that information, see how it flows from external structures from the CNS into the CNS. So that's afferent or arriving. And then we have visceral sensory, like for instance, we have here these visceral sensory neurons that bring information from the urinary bladder, in this case, afferent into the spinal cord. So what are the neurons then of the afferent sensory division or of the PNS? Spatial sensory, general sensory, and visceral sensory. A spatial sensory brings information about vision, hearing, equilibrium, taste, anything that is related to spatial senses. General sensory information, what type of information? Pain, touch, temperature, and then visceral, distension. Now, for the motor or efferent branch of the PNS, so we have the somatic motor division, which controls the contraction of skeletal muscles voluntarily through these lower motor neurons. And the information is efferent or exiting. So it goes from the spinal cord to this muscle. In this case will be the biceps brachii. And then for the ANS, the two visceral subdivisions, which is the sympathetic and the parasympathetic, you also carry efferent or exiting information from the spinal cord, but in this case, this is going to be involuntary because it controls internal organs like the heart and the urinary bladder. And then in this case, for this neuron will be parasympathetic motor neuron, and in this case, this will be for the heart sympathetic motor neuron. So we have three neurons: lower motor neurons, sympathetic motor neurons, and parasympathetic motor neurons in the somatic and the ANS divisions. Questions? Okay, so now for the peripheral nerves. So the peripheral nerves are composed of axons. Sometimes can be myelinated, sometimes they are not, depending on the axon. But basically, a nerve is a bundle of axons that it is wrapped around connective tissue membranes. The most external membrane will be the epineurium. And then collection of axons or bundles of axons will be wrapped around in perineurium, and then the individual axons will be wrapped around in endoneurium. Now, the endoneurium is not the same as the axolemma. The axolemma is plasma membrane, it has channels. This connective tissue, which will be collagen fibers, elastic fibers that are very delicate, they don't have channels. So it's not the same, the plasma membrane, as the endoneurium. Now, based on function, if your nerve has both axons that are sensory and motor, this will be a mixed nerve, which is typically the case. Spinal nerves are mixed, they carry sensory and motor information. And then we have rootlets that form these nerves. The anterior rootlets will be motor, the posterior rootlets will be sensory. And they join, they form the root of the nerve, and then you exit this nerve through the intervertebral foramina of the spinal cord, and then they go and travel through specific pathways to reach the effector. So they are signals that route these nerves to where they're supposed to go. And then cranial nerves. In the case of cranial nerves, they either connect to the brain or they exit the brain. And yes, in this case, we can have purely motor nerves, we can have purely sensory nerves, and we can have mixed nerves. We have 12 cranial nerves. You heard about them before. And they have different functions. In general, they can innervate structures within the head and the neck, like muscles, glands, and then they perform their specific function. So we will see each of these cranial nerves. But here is the illustration of these peripheral nerves. These peripheral nerves connect into the spinal cord. So here is the rootlets of the posterior branch of the nerve, which is sensory. So this will be the posterior rootlets, and these will be the anterior rootlets. So these rootlets are tiny connections. Now these rootlets forms roots. So you have the posterior root and the anterior root that emerges from these rootlets, and they both merge or anastomose to form a single peripheral nerve. Now, a difference between the posterior root and the anterior root is that in the posterior root, you have this posterior root ganglion that holds the body of these sensory nerves. And then you have an axon that extends and connects here to bring sensory information to the posterior horns. And then you may have an interneuron between the posterior horns and the anterior horns that arches and connects this sensory neuron to a motor neuron here, and then you create a loop so that you can bring action potential really quick so that you form a reflex. And then if you extend this spinal nerve, you can see that internally this spinal nerve is formed by, in this case, myelinated axons and unmyelinated axons. And then these axons will be wrapped around by endoneurium, and then you have fascicles that are wrapped around by perineurium, and the entire nerve, it is wrapped around by an epineurium. And just as any organ in the body, we need blood supply. So we have arteries, blood vessels that brings blood supply to these axons, and then we have veins that carry away this. And then you make a section of this nerve, and you see it with a fancy microscope, a scanning electron microscope, and you can see all these components.
It's like the model that you had in the
Yeah, I was going to tell that. We will see this again, but I took out like conduit with a bunch of wires, and then they were encased in plastic. So we will see that again, but that's what it represents. It represents a nerve. So that's a peripheral nerve. Now, these spinal nerves are located in different regions along the body from where they exit. And then we have eight cervical hairs, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. So how many are in total? 31. How many cervical vertebrae do we have? 8 or 7? 7. So we have one more spinal nerve than a vertebrae. And that spinal nerve exits between C1 and the occipital bone. So that's why we have an extra one. each of these spinal nerves monitor a particular area of the body, and this is called a dermatome. So with these dermatomes, we can pinpoint problems like when someone has spinal cord injuries. And that can lead, of course, to pain or numbness. And also can guide clinical procedures to block specific nerves when you need to do a neurological assessment or maybe as part of the treatment. And then some of these nerves monitor more than one area, so this is overlapping, which is good because let's say that you have injury in one area, you can have spare. Not necessarily that always happens, but unfortunately in some cases, some damage is irreversible and the person ends up with a numb area. And I already told you before, and you kind of understand it that way. I mean, what is the purpose of having sensory information? Why would you care about having this sensory information going into your brain and then knowing what is going on? Well, again, I remember about this long in the past that she had a surgery in her hip area and one of her nerves was damaged and she had numbness here after the surgery. And that never went away. But again, even numbness is a sensation, you just feel numb. But basically, again, if you have a sharp object and you're passing by, cut yourself, you wouldn't know. Or there's a hot object, you're just standing there, you will damage your body deeply. So there is a purpose then, even for pain. So here is the dermatomal map. So anterior part of the body, half, and posterior part of the body, the other half. So the area just below the chin and the mandible is monitored by C2, this area. And this upper part of the scalp, C2. Now this entire part of the neck is monitored by C3. And this part. So basically it goes like this, C3. C4, here. And then we have all of these segments, like for instance, L2 is here, S1 here, here, L3, L4, L3, L2, S1, S2, C6, T2, T1. So each of these monitor a specific area. So if someone taps in your shoulder, that's the nerve that picked up, C4, and also here. So whenever someone performs a patellar reflex, they're trying to see if you have L3 spinal nerve without any problems. Okay. So then this is the dermatome. Any questions about spinal nerves, the general information? Okay, now for cranial nerves. Let's start with the sensory cranial nerves. So we have olfactory cranial nerve number 1, optic nerve cranial nerve number 2, and we have vestibulocochlear cranial nerve number 8. Olfactory, it starts at the olfactory mucosa in the roof of your nasal cavity, extend axons that goes up, traverse the cruciform plate of the ethmoid, and then connect in a region of the brain below the frontal lobe that is called the olfactory bulb. The olfactory bulb, after synapses with these neurons coming from the nose, it extends a series of axons that goes laterally like this, or from anterior to posterior like this, forming the olfactory tract, and that information goes into the olfactory cortex. So function will be to have the sense of smell and then bring that information into the medial temporal lobe and the limbic system. Optic nerve starts with the ganglion cells from the retina that extends axons that goes and form the optic nerve, and that optic nerve passes through the optic canal in the sphenoid. And then part of this optic nerve, like the middle half, is going to cross to the other side. So it will form just behind the pituitary gland a little structure is called the optic chiasma. And then the lateral half of the optic nerve from each side is going to continue ipsilaterally. And then they will form the optic tract. The optic tract will reach the thalamus in the lateral hypothalamus in the lateral geniculate nucleus. And then from there, you will extend axons that forms like radiations, which are called optic radiations, and then you bring that information into the primary visual cortex. So that's the optic nerve. And now vestibulocochlear, it is this huge nerve that forms from our ears. In our ears, we have the vestibulocochlear apparatus, which looks like a little snail. You will see that in the spatial senses. But then we have axons that are specialized for sensing auditory information, and we have axons that are important to maintain balance. So then the nerve, this name, it takes its name because the vestibular part is the one that is going to come from one part of this apparatus and is going to carry the information about balance, while the cochlear will be about hearing. And then the vestibular fibers will go into the cerebellum so that we can maintain balance, and also into the medulla, because we will have connections there with cranial nerves that help us to create some reflexes to maintain balance. And then the cochlear fibers will reach the auditory cortex so that we can interpret the sounds, and then we can determine whether it's high pitch, low pitch, loud or not loud. So those were the two purely sensory nerves. And now we have motor nerves, cranial nerves. So we have 3, 4, 6, 11, and 12. Number 3 is called oculomotor. Oculomotor, it helps to move 4 extrinsic eye muscles. You already saw those ones. And as well, controls the dilation of the pupil and help us to see clearer because it's in charge of accommodation by changing the shape of the lens. We will see that better in the spatial senses chapter, but this oculomotor or cranial nerve number 3, it is then the one that innervates more muscles in the extrinsic part of our eye than the rest of the nerves, and also innervates the levator palpebrae superioris muscle, the one that helps us to open our eyelids. Trochlear, or cranial nerve number 4. This one controls only one extrinsic eye muscle, which would be the superior oblique. If you remember, superior oblique help us to see down and out. That's your cheater's muscle. So that's innervated by cranial nerve number 4. Abducens, cranial nerve number 6. It is that nerve that helps us to our eyes to be directly going straight in front of you, because our eyes, if we didn't have this cranial nerve, will tend to go medially and down. But with this muscle, we at least abduct the eyes so we can look straight. Okay, so that's abducens. Accessory is cranial nerve number 11. It has a spinal root, and then the spinal root helps to control the contraction or the function of the sternocleidomastoid and trapezius. And then the other part controls part of the throat muscles, and as well help us to have taste sensation in the posterior third of our tongue. So that's cranial nerve number 11. Hypoglossal, it helps us to move the muscles of our tongue, intrinsic and extrinsic. And that one passes on the side of the spinal cord in the foramen magnum, passing through the hypoglossal canal. So those were the motor nerves. Now for the mixed nerves. So we have trigeminal or cranial nerve number 5. We have facial nerve or cranial nerve number 7. Glossopharyngeal or cranial nerve number 9. Sorry guys, I was thinking in cranial nerve number 9. Cranial nerve number 11 doesn't participate in the sensation of taste. I was thinking number 9. So number 9 is glossopharyngeal nerve, and then vagus nerve is cranial nerve number 10. So trigeminal, it is called trigeminal because it has 3 branches that innervates ophthalmic area, maxillary area, and mandibular area for body. Tri means for 3, Gemini for twins. Of course, there is no 3 twins, but whoever describes it, they just put trigeminal. So it has sensory information for the face, oral, and nasal cavities. So I guess no matter where in your face they hit you with a ball, or maybe they slap you, that pain sensation, it is going through the trigeminal. And not only is that, but also we have a sensation for temperature. If an object is hot or cold, they put it next to your face. Well, that's a trigeminal. And then this one is motor because it controls the contraction of muscles of mastication. And then the 3 branches, you call it B1, B2, and B3. Facial nerves, contract the muscles of facial expression. The sensation is to taste, for taste sensation, 2 anterior thirds of our tongue. And then parasympathetic activity, it helps us to produce tears with our lacrimal glands and control the production of saliva, some salivary glands. Glossopharyngeal provides taste sensation to the posterior third of the tongue. Also help us to contract muscles of the pharynx and provide sensation from this area, and it innervates the parotid gland. Then finally, the vagus nerve, which is the longest nerve, cranial nerve in our body, it sensory, it provides sensation from structures from the throat, ear, thoracic, and abdominal organs, and controls muscles of the pharynx and the larynx, and is part of this parasympathetic system that decreases, for instance, the heart rate, produces bronchoconstriction, and increase the rate of digestion, so the movement of our digestive viscera.
Okay.
So we will